It's likely you're either sick right now or know someone who is. Health experts warn we are in the midst of a very bad flu season.
So we saw it building up about a month ago, but now it's absolutely everywhere. Nearly every PCR test I send is positive for flu.
Many emergency rooms across Ontario are feeling the strain. Niagara Health, for example, is reporting hospitals in that region are seeing an alarming spike in flu cases, with a growing number of patients requiring hospitalization, including several in intensive care. Toronto ER doctor Kashif Prasada is seeing a similar stream of patients and tells me many are waiting in ambulances for hours to be admitted.
A flu is like getting hit by a truck. You have body aches, fatigue, high fevers lasting a week almost. And many children and elderly especially need, fluids or oxygen to recover, and they usually need a few days of hospital to do that, and that's what's filling up our hospitals right now.
The Public Health Agency of Canada is reporting flu activity is widespread in Ontario, BC, and Quebec, and cases are expected to rise, while COVID-19 and RSV infections are decreasing. This year's flu season got off to a late start, something we haven't seen since pre-pandemic times, and because of this, some health experts say vaccine immunity from flu shots may be waning.
We only really get the best protection from symptomatic infection for about 3 months. So when the flu season is a lot later than when we actually got vaccinated, that can mean that their vulnerability to becoming infection increases.
Dawn Bodish is a professor of medicine at McMaster University and tells me the most vulnerable people right now are the elderly, the very young, pregnant people, and those with underlying health conditions.
Is it still worth getting your flu shot?
It is absolutely worth it. The best time to get a vaccination is right at the beginning of a wave, because then you have that maximal protection right when you're most likely to get sick.
Now, if you're experiencing dehydration, extreme fatigue, or rapid breathing, health experts say those are some symptoms that could require a visit to the emergency room. Normally, influenza cases would have peaked by now, but this year that likely won't happen for a few more weeks. Shauna Hunt, City News.